Welcome back to your Pediatric Dentistry channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my previous videos. In last videos, we discussed 7 psychometric assessments used in adults and children both. Today we will discuss the remaining. The PAQ scale, which is Pictorial Anxiety Questionnaire. So the PAQ scale is a validated child-friendly tool used in pediatric dentistry to assess dental anxiety through visual cues. It is especially effective for children aged 4 to 14, including those with the limited verbal skills or the spatial needs. These are the dental scenarios. Each scenario is accompanied by 5 facial expressions, which is very happy, neutral, slightly anxious, and very anxious. Children select the one that best represents their feeling. So these are the different scenarios, and the purpose is to predict the different type of anxieties. For example, sitting in the dental chair will assess the comfort with the clinical environment. So these are the 15 scenarios asked in this scale. Scoring and interpretation: each response is scored from very happy, neutral, slightly anxious to very anxious. Total score range will be 15 to 75. So the scoring in between 15 to 25 low anxiety, 26 to 40 moderate anxiety, 41 to 75 high anxiety. Then the HEQ scale, which is Hospital Anxiety Questionnaire. HEQ scale is a psychometric tool used to assess anxiety in clinical settings, including dental environments. In pediatric dentistry, it helps identify children with elevated anxiety levels before treatment, guiding behavior management strategies. It includes 14 items designed to assess general health related anxiety, and it can be adapted for the dental settings to screen pediatric patients before treatment. So these are the original HEQ items. These are the dental adaptations. So for example, do you ever worry about your health? And the dental adaptation you have to ask in the dental settings is, do you worry about your teeth or dental visits? So these are the 14 scenarios, and each item is rated on Likert scales, which is 0 not at all, 1 a little, 2 quite a bit, 3 very much. And the scoring and interpretation, each item scored 0 to 3. So the total score range will be 0 to 42. So 0 to 10 low anxiety, 11 to 20 moderate anxiety, 21 to 42 high anxiety. Use in pediatric dentistry. So pre-treatment screening: identified anxious children before dental procedures. Behavior prediction correlates with the cooperation levels and likelihood of the disruptive behavior. Treatment planning guides use of technique like tell show do, distraction, or sedation. Spatial population useful for children with the chronic illness, prior trauma, or dental phobia. Then the FDP questionnaire, which is fear of dental procedures. FDP questionnaire is a structured tool used to assess specific fears related to dental treatments. It is specially used in pediatric dentistry to identify anxiety triggers and guide behavior management strategies. Each item asks how fearful are you of, followed by a specific dental stimulus, and the responses range from not fearful at all, slightly fearful, moderate fearful, very fearful, and extremely fearful. So here are original 18 items. For example, how fearful are you having a tooth drill? Then the scoring and interpretation. So 18 to 16 fear level will be low, and the clinical strategy should be routine communication and behavior techniques. 17 to 28 fear level will be moderate, so clinical strategies should be use modeling, visual aids, and parental support. 29 to 40 plus fear level will be high, and the clinical strategy should be desensitization, shorter appointments, sedation if needed. Using pediatric dentistry, behavior prediction identifies children likely to show disruptive behavior. Treatment planning helps tailor desensitization, sedation, or communication strategies. Parent communication: it provides objective data to discuss anxiety with caregivers. Research utility: used in studies comparing anxiety levels across ages, gender, and interventions. Then the single item measures. Single item measures in pediatric dentistry are brief tools that assess dental anxiety using one direct question. They are quick, easy to administer, and useful in busy clinical settings or with the children who have limited attention spans or verbal skills. There are so many formats used in this type of scale. For example, visual analog scale, numeric rating scale, a pictorial scale, and many more. Here's a complete set of single question format used to assess dental anxiety in children. So in visual analog scale, how scared are you of going to the dentist today? And the response type should be make a 10 centimeter line and ask child to mark on the 0 to 10. 0 is not scared and 10 is very scared. So it is best for age 8 plus literate children. In numeric rating scale format, on a scale of 1 to 10, how anxious do you feel about your dental visit? So you have to ask child to give the answer verbally or written between number 1 to 10, and this is best for the age is 7 plus and verbal children. Facial image scale format, point to the face that shows how you feel about going to the dentist. Choose from 5 cartoon faces. You have to put 5 different faces from happy to scared, and it is for age 4 to 8 non-verbal or early verbal children. Then smiley face scale format, which smiley's face shows how you feel about your dental visit. So you have to give 5 to 7 smiley faces and ask them to point out one of the 5 to 7 smiley faces. It's best for the ages 3 to 7 children with limited verbal skills. Emoji scales, which is digital, tap on the images that shows how you feel about seeing the dentist today. So they tap on the screen from the emojis happy to anxious. Age 6 plus and tech friendly environments. Color scale, pick a color that shows how you feel about your dental visit. So choose from calm, which is blue color, so blue to red. Neurodiverse children or those with the sensory needs, this is the best for them. Thumb scale format, show me with your thumb up if you feel okay and down if you feel scared, which is the physical gesture. It's best for the age 3 to 6 non-verbal or shy children. Pictorial card short, so pick a card that shows how you feel about the dentist. Select from illustrated cards. So this is same as the different emojis or different faces you can put on the different cards and ask them to choose between that cards. And it is best for children with the developmental delays. Yes or no question, are you scared to go to the dentist today? They have to ask in yes or no. Very young or cognitively challenged children. Story prompt, if you were going to the dentist, would you feel like a superhero or a scared bunny? Choose character, and by choosing character, you will know if the child is anxious or calm. Ages between 4 to 7, imaginative or playful children. Interpretation guide is 0 to 10 scale. 0 to 3 low anxiety, routine communication and standard behavior techniques. 4 to 6 moderate, use modeling, visual and aid and parental supports. 7 to 10 high, desensitization, shorter appointment, advanced behavior guidance. Advantages are time efficient, easy to understand, useful for children with the developmental or communication challenges. Limitations, less diagnostic depth than multi item scales, obviously, may miss specific anxiety triggers. Now coming to the general scales used to measure dental anxiety, these scales not specified any age. So the state trait anxiety inventory, short form STAIS. So the state trait anxiety inventory short form is a validated tool used to assess transient anxiety levels in dental settings, including pediatric dentistry, though its use in children requires adaptation. The STAIA developed by the Spielberger et al. Measures two dimensions of anxiety: trait anxiety and state anxiety. So the state anxiety are the temporary emotional state triggered by specific situations, for example dental visits, and trait anxiety are the general tendency to experience anxiety across situation. So STAIS short form is often preferred in clinical settings for its brevity and ease of administration. It has been used in adult dental anxiety studies and with the modifications in pediatric context. So here are 6 items: I feel calm, tense, upset, relaxed, content and worried. These items are typically rated on a 4-point Likert scale, which is not at all to very much so. If you ask them, I feel upset, so they will rate not at all, then the score will be 1. you have to give them reverse scoring in the calmness and relaxation. So positive items indicating calmness or relaxations are reverse scored. So if you ask them, I feel calm, and they will give very much so it is basically the score 4. For this question, positively converted into 1. In negative item, the score are directly as we saw. So total score calculation. So after adjusting for reverse scoring sum all 6 item scores, the minimum score will be 6, which is very low anxiety, and maximum score will be 24, which is very high anxiety. Pediatric adaptation. In pediatric dentistry, these items are often simplified linguistically for younger children, paired with the visual aids, for example, emojis or faces, used with the parental assistant or modified format like emojis STAI scale. And then the heads anxiety subscale, which is hospital anxiety and depression scale, developed by Zygmunt and Snaith in 1983 for use in hospital OPD settings. Validated 7 item screening tool for anxious symptoms, widely used in dental settings, and cautiously adapted for adolescents in pediatric dentistry. So these are the questionnaire items, and they have to score between 0 not at all to 3 most of the time. And same use reverse scoring in this questionnaire also. So basically 0 is definitely 1 is usually not, often is 2, and 3 is not at all. And you have to reverse the scoring in positive outcomes. Scoring interpretation: 0 to 7 normal, 8 to 10 borderline anxiety, 11 to 21 clinical anxiety. Used in pediatric dentistry, this scale is not originally designed for children. However, adolescents may complete it reliability. Modifications may include simplified language or visual aids used to assess pre-treatment anxiety, especially in orthodontic or surgical contexts. Less common in children under 12 due to cognitive demands of self-reporting abstract emotional state. The last part, which will be the next video, we include child specific anxiety scale, and in the end of that part we will give you all the references. So stay tuned, and if you want this as a PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. We also put lots of MCQs related to pediatric dentistry with topics revision on our shorts. So press the bell icon for every update. Like, share, and subscribe. Thank you.